is legal and where safe services are accessible, both unsafe abortion and abortion-related mortality and morbidity is reduced. The Global Leaders Network advocates for life-saving interventions as well as sexual and reproductive health rights. Now, as South Africa, we know this from experience. The Choice of Termination of Pregnancy Act, which adopted soon after our own freedom, contributed in 1996, contributed to a decline of termination of pregnancy-related mortality by 90% between 1994 and 2021. This law that was passed through a democratic process amidst robust debates and significant pushback, but it is now being implemented and it has resulted in a great deal of progress and success. But in the end, scores of women's lives have been saved. Prevention of unintended pregnancies, comprehensive sexual education, and preventing violence against women and girls are still priority interventions, but complementing these with sexual and reproductive health rights can save more lives. We understand that countries have the sovereign right to make determinations on issues of termination of pregnancy, and that should be respected, because in the main it could be an expression of the will of the people. The Global Leaders Network is called upon to protect the rights of vulnerable populations and present evidence that demonstrates a reduction in morbidity as well as in mortality. We therefore issue a call to action. We call on heads of states and government to seriously take women and children and adolescent health up in everything they do and join the Global Leaders Network. We also call on countries as well as on donors and commercial and developmental investors to carve out a specific funding agenda for women, children, and adolescent health. And we do, yes, also make a call on countries across the world to collaborate and to work together and cooperate to meet the financing targets for organizations that support women, children, and adolescents' health. These include the Global Financing Facility, UNICEF, and UNFPA. We call on stakeholders in the women, children, and adolescent health sector to target those countries with the highest maternal, neonatal, and adolescent mortality rates, and there are quite a number of these. And we also call on academics and civil society to continue to provide evidence and compelling arguments so that urgent political attention and action can be taken, including investment in the health that affects women, children, and adolescents. And we call for equity in manufacturing, in access to sexual and reproductive health products, and in quality health services for women, children, and adolescents. And that should lead to the health systems being strengthened, and that also should address the health outcomes in the end. Now, as the chair of the Global Leaders Network, I want to thank everyone who's been involved in this critical initiative. And by your mere presence here and the work that many of you continue to do in your various positions and organizations, you are helping to move the needle. But we need to do much more to save the lives of millions around the world. And we can, I believe, reduce poverty and inequality. We can, I do believe firmly, that we can improve productivity and develop economies and transform communities across the globe by improving the health outcomes for women, for children and adolescents. We will be taking steps in that direction. So if we all act together, but not only act together, but we need to raise the level of awareness and consciousness, because quite often you find that many people are not so aware and well conscientized about the alarming statistics that we saw in the video, that women continue to die needlessly, and yet we can take action to prevent that and to lessen the deaths of women, but to also improve their health. Women, children, and adolescents must be prominent in our agendas to improve health across the world. And so if we can continue with that resolve, we will certainly achieve a number of objectives. Thank you very much for being here.
Thank you, President Ramaphosa, for your leadership and for the keynote address. And it was really touching to hear that when the freedom of your people was achieved, women's sexual and reproductive health and rights were also secured at that time. The two went together, and we thank you for your passionate commitment to these issues and for speaking from the heart. Thank you so much. Now, I would like to invite His Excellency Dr. Ruto, the President of the Republic of Kenya, to come forward and tell us about his vision on how we can accelerate action to end preventable maternal, newborn and child mortality. Dr. Ruto, you have the floor. Thank you.
Thank you very much. Excellencies, distinguished ladies and gentlemen, it is inspiring for me to know that we are all here to actualize our shared aspiration to address missed opportunities in improving the welfare of women, children, and adolescents with urgency and a spirit of partnership. The Sustainable Development Goals and the Global Strategy for Women's, Children's, and Adolescents' Health were launched in 2015. Yet with only 5 years remaining to meet these goals, only 16% of targets are on track, while an overwhelming 84% show limited or no progress. It is deeply concerning that maternal mortality, stillbirths, and neonatal deaths remain critical issues in sub-Saharan Africa and Southern Asia. In 2020, these regions experienced 300,000 maternal deaths, 1.9 million stillbirths, 4.9 million under 5 children's deaths, and 1 million adolescent deaths. Although Kenya has made considerable progress in reducing maternal and under 5 mortality, challenges such as inadequate funding and limited capacity to provide essential services persist. We recognize that only a multi-sectoral approach, including healthcare, education, and community support, can accelerate mortality reduction. Towards this end, it is therefore essential to increase investment, enhance collaboration, and focus on primary healthcare to scale up key interventions like skilled birth attendants, vaccinations, and improved nutrition. Recognizing that only urgent collective action can save millions of lives by 2030, we have pledged to enhance partnerships and establish a dedicated fund for maternal and child health. This fund will help advance progress towards SDGs by improving service delivery and expanding access to essential care. From an economic perspective, keeping people healthy is immensely beneficial. Studies show that every dollar invested in maternal and child health yields $9 in returns through improved health and productivity. Any annual investment of $1.5 billion could save 35 million lives by 2030 and generate $100 billion in productivity and healthcare savings. We have a singular opportunity to escalate our contributions to global health initiatives and significantly enhance their impact by supporting Africa Health Strategy and KAMA campaign, that's campaign on accelerated reduction of maternal, newborn, and child mortality in Africa, as an ideal starting point. It is important to emphasize, however, that investments must be complemented with robust transparency and accountability measures. This is why Kenya supports initiatives like the Africa Peer Review Mechanism and Reproductive Maternal, Newborn, Child, and Adolescent Health Scorecard to track progress and to prevent unnecessary deaths. The return on investment in adolescent health is estimated at between $5 and $10 spent, with school-based and community-targeted interventions being highly effective. In Kenya, therefore, we are deploying community health promoters to bring vital health information and services directly to communities as part of our commitment to a sustainable and equitable future by securing the health and well-being of all women, children, and adolescents. We have had a robust conversation in Kenya. We had two programs that were running. One, Linda Mama, that was an insurance program to make sure that every mother who is going to give birth, the government of Kenya pays for the prenatal and postnatal services. We have since, under our new universal healthcare program, expanded that to include the child up to 5 years, so that we can take care of that moment in time when children are most vulnerable, between ages 0 and 5. We have also expanded what initially we called Edu Afia, or Education Afia, where we had an insurance program for all our secondary school children. Under our new program, we have expanded that to include every child from primary school to age 18, so that every adolescent has a government-paid-for insurance program to take care of their health needs. This expansion of the programs that we are undertaking is in partnerships with friends. And I am very happy that in this audience, Professor Senait, who is here, has been working with us and has gone out of her way to pay for some of our women and children in that program. It is a complementary partnership between private and public in making sure that we secure the health of our people. We have every reason to be confident that together, as President Ramaphosa said, we can create the future we envision by prioritizing equity and inclusion in healthcare access, increasing funding, and strengthening our commitment to SDGs. If we can act in unity and without delay, nothing can stop us. And I'm very confident that we will work this together. and you have our solidarity, support, and partnership. I thank you.
Thank you so much, President Ruto, for that strong commitment you expressed, and also for the focus on the primary health care, the skilled birth attendant, the vaccination, the nutrition, the whole package that is so important in achieving these aims. I'm now going to welcome His Excellency President Boakai of the Republic of Liberia to come and speak to us about his vision for putting women, children and adolescent health and well-being as a top priority on the global agenda. Mr. President.